Dr. Martinez, I'll have one more question about dentures. Lately, actually for the last few years, but lately again quite a bit in ABC World News, I think, there was a whole lots of stuff in it, how denture adhesives, denture cream, whatever you call that stuff, are laden with zinc, and while zinc is a good thing, we need it, too much of it cannot be good, and apparently nerve damages, tingling in the feet, legs, arms, fingers, muscle weakness, numbness and stuff like that, and literally brain damage, people in a wheelchair have occurred, apparently. What do you know about it? And if it is so, would a denture, which you described very well in another video, which is supported by a couple, 2, 3, 4 implants, and thus fits better and is just phenomenal, a world of difference compared to a normal denture, would such a denture also eliminate the need for this, perhaps, not sure, devastating cream?
Most definitely. That is probably one of the biggest advantages, is that you don't have to wear any adhesive when you have an implant retained denture, because it clips onto your implants. So you don't have to wear the little cloth, you don't have to wear any powder, and you don't have to wear the cream.
Frankly, having never done that, and once or twice I got an impression made. I don't know whether that's the same, but frankly, I'm not a cream type. It must be being a very, very beautiful relief not to have to, put some cream things on it. In fact, even in teeth whitening, the people at home or doing the dental teeth whitening kit, many people just say, you mean I can avoid this cream and tray? Or why don't I just go for a 1 hour, pay a little more, been done in 1 hour, but most importantly, I don't like that yucky thing on my thing. I mean, it must be a good feeling from my viewpoint, but having never done it, how would I know? What do your patients say?
Exactly. No, that is probably one of the biggest things when people come in and say, I can't eat, I can't chew my food, I'm getting these sores, and I'm tired of having to buy this adhesive because I can't taste my food, I can't. So yes, that's probably one of the biggest advantages of having an implant retained denture, that you don't have to wear the creams or the little cloth or the powders, because I've never done it, I've never worn that myself. But I have seen many patients, and it is really a big relief for them. I think what happens is once they don't have to wear it, they're like, are you sure? The teeth are not going to fall off when I'm eating or anything. But again, it has to be an implant retained denture in order for you to be able to clip onto this. And as far as for the damage, I know that they recalled the cream that supposedly, allegedly was causing the issue. But again, do you really truly know what causes anything? I mean, pretty much every day something comes out that says that it's causing something. So I personally don't know of any case or anything whatsoever in that regard. I know the story. I've heard the news. I've read it from my supplier actually. But it is really something you have to see and read the study. Where was it done? Is it a legitimate study, or is it just somebody trying?
But here's the deal, Dr. Martinez. Certain things you don't quarrel about. Just like it was never really proven that this person in Florida some 15 years ago got AIDS from the dentist. The point is, it stirred something up majorly. I think you were already in dentistry back then. And here's only one question. It's like, was it proven? No. Did everybody start sterilizing about a truckload better than before? Yes. Can that possibly hurt? No. So let's do it. Again, you said that not having this adhesive is phenomenally better. So why don't you switch? And would you suggest that if a person, which doesn't have to come from that cream at all, has tingling and numb fingers and feels a certain weakness in his overall muscle structure, should he go to a doctor, to a physician, to a nerve doctor and check it out and at least make sure that whatever causes it, which even the doctor might never find out, but at least that he takes treatment for it, because it is a serious thing. It wouldn't matter what caused it.
Of course, no. They have to do that. My philosophy on that, or like the way I would treat if there was my parent or that has a denture, is eliminate all the possible causes that are, they talked about the cream. Well, eliminate that, but getting a denture that fits, getting a denture that is retained. Once that's eliminated and out of your system for a while, then if you continue with the symptoms, then follow up with it. But that would take care of it. But again, until you go through it, until you do it, you will never really know.
So, possible, only very possible benefit for health effect, but for surely a better lifestyle if you take that adhesive stuff out and go for what's new. Thank you very much, Dr. Martinez.
Thank you.